We're going to be debunking vasectomy myths, and both our guests are seated in hot seats this morning. Dr. Samuel Mikaye is a medical officer with Mary Stopes, and Salano Inzai underwent vasectomy in 2022. Gentlemen, good morning to you both.
Good morning to you.
Good morning.
Karibu sana.
Asante.
So we're looking into some of these issues surrounding vasectomy and what people think or don't think. We're going to get into that proper. But before we do that, we're going to welcome you to the Situation Room with a proverb. Dennis will tell you which country we're in, and then we're going to tell you what the proverb is, and then you can interpret that for us, right?
Yeah. Yes.
Okay.
So the proverb today comes from Tunisia, whose capital is Tunis. And it is a country that is located North Africa, bordered by Algeria to the west, Libya to the east, and Mediterranean Sea to the north and east. Now, the language is Arabic. Now, few facts about Tunisia: a population of around 11.2 million people, and they got their independence from the French, so the country majorly speaks Arabic and French. And some of the things that stand out about it is they have World Heritage sites in the country, the Carthage ruins that stand there as well, and the couscous cuisine. So the next time you visit there, just the same way you come to Kenya and you say we want nyama choma, couscous cuisine when you go to Tunisia, right? And our proverb today is a bold woman boasts of her sister's hair. A bold woman boasts of her sister's hair. What do you make of that, Doctor?
A bold woman, my take is someone who's bolder will be proud of everyone, including the family. Mm-hmm. That's my take on that.
Straight and sharp.
Okay. And what about you, Salano?
I think it means that if you know yourself, you won't be intimidated by someone else's beauty.
Yeah. Absolutely. There it is. Confidence in your own. Yeah. Great way to look into things and start off today. So let's get comfortable into a situation or into a conversation that for many isn't, but necessary to know when we start to look at many things around it. So, Dr. let's start with you as we look into vasectomy. What exactly is vasectomy?
Before I start the definition of vasectomy, kindly allow me to introduce myself again. My name is Samuel Mikaye, a medical officer working with Mary Stopes, Kenya, which is an affiliate of Mary Stopes International, currently based at Isli. So when we say about vasectomy, we mean it's a minor procedure which takes around 15 to 30 minutes. Then the procedure it involves blocking or tying the sperm duct, which is also known as the vas deferens, with the aim of not allowing the sperm and the semen not to mix, so that you can effectively prevent pregnancy.
Okay. And you say it's a 15-minute procedure.
15 to 30 minutes.
15 to 30 minutes.
Yes.
Who does vasectomies? Rather, who are the candidates for vasectomies?
The candidates for vasectomy, it can be anyone, regardless of the age, as long as someone has made a decision that he does not have a desire for having children in future, because it's a permanent procedure.
But what is other recommendations from the doctors whenever anyone processes themselves? How do you gauge that they are the right candidate? What's the process you take them through?
The process is we explain the procedure to the patient in terms of counseling. We tell them it's a permanent method, and then we express to them that it's an irreversible procedure. Then from there, once the patient has decided that he is willing to take the procedure, then we offer the procedure regardless of the age of the patient.
Salano.
Yes.
For us men, vasectomy is a conversation we really don't want to have. Snip. Kuna siku. Never ever, But you sit here as someone who saw this opportunity, considered it, went through your doctors. Why?
I have many reasons why I did that. The first one is that I came from a very big family.
Okay.
My parents had a lot of children, and growing up, I saw the pressure that was on us to go to school, to acquire basic things like food in the house. It was always about struggle for the fittest. Is it?
Yeah, survival of the fittest.
Yeah. because you can't get good education, you can't get good food. So my prayer was always that if only were just the two of us, it would be very easy for our parents to manage. But now, see, we can't even get a uniform. Our uniform always patched with pieces of rags. So I said, when I grow up, I'll only need to have 2 children so that I'll give them the best they can get in this life without straining anywhere. So I got married when I was just in university first year. So I got my wife who also came from a family that they were just 7. They were 7 and she was the firstborn. Their parents were also just farmers. And she talked about having a lot of issue and pressure going to school because of that big family and no resources. So also she said that if we just get 2 children, we'll be good to go. So I said, so we are on the same page. 2, and then we are done. Let us get a boy, a girl, then we stop from there. But vasectomy never came in my mind. It was about family planning for women. So after campus, we got our first set of kids who were twins, a boy and a girl. So he said, we are done. There's something we're going to do. So what next? As everyone else knows that family planning is a women's thing. So I told her, you go and see what can work for you. So she kept on trying, and they were always very, very tough on her. There were adverse side effects that she was experiencing when she was going through family planning methods. She will try the injection, she will try the pills, she will try the coil, all of them were having she will sometimes just bleed for over, like instead of going for 4 days on her periods once in a month, she will even go 7 days 3 times for almost 3 weeks.
Wow.
Continuous, just bleeding. Sometimes she will so I'll tell, remove that, you try another one again. She will begin adding weight, having acne. She will begin having blood vision. She will be having migraines throughout the day. Her sex libido just went down. So I felt like she was really suffering. So I said, okay, let us try the one that was somehow mild to her was the 5-year implant, which she took, and then on the 3rd year, before the expire of the 3rd year, the 5 years, she got pregnant again. So we got our 3rd baby. That was in 2022.
So the plan for 1 and 2 was out the window now, but obviously by the 3rd one. The plan for 1 and 2, because now there was number 3.
Yeah, the number 3 is already now here and unplanned for.
Okay.
But now we are happy that we have a baby. We're not regretting the decision. So now we said, what do we do now? We said, let us try something else. So when you were going for the clinics, one of the nurses suggested, now that you've said all these methods are always very, very hostile on your wife, can't you try vasectomy? And I was like, no. That's not something that's done for human beings, for animals. Because where I grew from, I saw it being done to cows and dogs, castration, and that's what it means. And that's what most men think about as
vasectomy is just
castration. That once you're done, you are finished. You are no longer a man. So she told me, you can go and think about it. So I went and did a lot of research on vasectomy. I did a lot of studies online, and I was looking up to what does it entail? Is it really castration? Can you perform after that? Because that was the fear. I'm still young and I have years ahead to go. So now I told my wife, what do you think about this? She told me, no. You can't do that because this thing is going to affect you. I better just keep on doing this. But she had sacrificed over 10 years in our marriage, and I think I should do something to help her carry this burden. So that's now where I went. I did more research. Again, went to the nurse. She told me, no, what you can do, speak to this doctor. He's a man who did it many years ago. He's a doctor and also a person who has done it, so he can give you good advice. So I took time. I called the doctor. He told me, yeah, I did it 14 years ago. And I'm fine. I'm performing. Nothing has changed. In fact, my marriage is even better than then.
Yeah.
So I was like, okay. So I should consider. He told me, come and meet me. So I met him. He convinced me it was a good thing to do. He was really encouraging me. I said, I think I should go for it.
Okay.
Yeah.
So, Daktari,
Yes.
What his initial fears are is probably something that a lot of people do fear. Is it actually castration, vasectomy?
No, that is a myth. Vasectomy is a process where we block the sperm duct, and we block the sperm duct, also known as the vas deferens. We don't do any interference in terms of with the testes, so it's not castration as it's perceived. Though there are certain situations where maybe a patient can have maybe the testes removed under medical condition. It's called oculoctomy. So castration involves the crushing. We don't crush, and we also don't interfere with anything with the testicles. Yes, so it's not castration.
Okay.
You see, for a very long time, and I'll just put it the way it is, like the conversation on the street is jembe lazima ilime. You know what I mean? There is the fear associated with vasectomy that I'm unable to perform, you know. But here you are saying you went into it and you were given assurances that it is working. So in terms of you've gone through it, the ease that is now with your wife because she doesn't have to go through this, paint that picture on how you saw your wife after dropping the family planning methods she was using.
I think Namona can say that I became the most loved husband.
Oh.
And she felt like she had just relieved a very heavy burden from her shoulders because she was no longer going to do these things. And her life became so easy. You see, when someone has carried a burden that has been a struggle to you, and you know me, I was like Jesus, because now when I carried that burden, I didn't feel the weight of that burden. You see, there's someone who can take your weight and then he feels the weight, but I never felt the weight because nothing was added in my system. I was not now suffering any side effects. Vasectomy has 0 side effects. The only thing I felt, maybe the small swellings after 3 days, it went down. And then the normal pains, maybe you felt something touched your bones, and then I took some Panadols, and then that was it. So I took the burden without feeling the weight. And then she felt now things have really now become so free. And then even our marriage just changed. Things changed because even you can imagine when you're doing our bedroom affairs, you are like, you don't have that thought like, hey, or will she get pregnant again? Or will this thing come? You don't have such minds. You are as free as, I don't know, if you take your wife to Ombaso and there is no one who knows there is a free environment, and you that freedom that came with it. So that's now how we really improved.
It's like a rally vehicle in Naivasha.
Exactly.
Kaende.
Hakuna sijui jam, hakuna nini, smooth flow.
So, Dr. when we talk about, we've heard the issues of partial and complete vasectomy. Could you explain what those are, and do they actually exist, or are those along the myths as well?
Partial vasectomy, it's usually the procedure itself. Once vasectomy has been done, you are given a return date where you are supposed to do semi-analysis so that you can rule out the likelihood of having partial vasectomy. Then in case you find this, the procedure is called semi-analysis or sperm count. In case you find that there are still sperms within the semen that the patient has given, you do another repeat until there is no sperm count. So likelihood of partial vasectomy is not possible, but sometimes there are people who can get who can still make women pregnant because of likelihood of reconnection after vasectomy. So there's no partial and permanent vasectomy. So it's about possibilities, because anything medicine, there's nothing that is 100%. We peg it at 99.5% in terms of success rate or effectiveness.
Okay, so under what circumstances would it fail?
Pardon the question?
Under what circumstances would a vasectomy fail? If somebody went for a vasectomy and then lo and behold, a year later his wife is pregnant, one would assume that the vasectomy failed, or, you know, maybe it was not his child. But in the case that we are saying that all factors remaining constant, under what circumstances would a vasectomy fail?
Failure rate is very rare. More so when semi-analysis after the 3 months, there's no sperm count. Failure rate is almost 0.5%. So it's a 99.5% effective method.
Okay. So is it possible for someone, a woman, to get pregnant if her partner had a vasectomy?
It is possible after some time because of the 0.05% that we are 0.5% that we are saying. There's a chances of maybe reconnecting after the vasectomy has been done. The physiology, the mechanism behind it is not better understood, but there are more research is being done on the same why they usually fail, but it's very rare. Yes.
So today I've walked into a doctor's office. I've gone through the procedure. How long do I stay before engaging my partner?
Usually the advice is after the procedure, you are supposed to avoid strenuous activities that includes sexual intercourse for a period of 5 days. Then to allow you that you can be able to heal. Then after that, you need a backup plan. Let's say because we need a backup plan for a period of 3 months or a duration of you need to have at least 20 ejaculations before you can now be sure that vasectomy is done, because it doesn't work immediately. It takes a duration of 3 months or 20 ejaculations that you can make that decision now that it's now a sure family planning method.
When you say backup plan, what is that?
Backup plan is you tell the client, you advise on different family planning methods, because usually we said the process is you are supposed to block the tubes. So in the process of blocking, we find that there are some already sperms which are already within the tubes.
Still be in the tank.
Yeah, so you give the patient yes. You give the patient adequate time so that you can so that they can be cleared before you say that now he is on fully a permanent family planning method.
Yes. So, Dr. what happens? Oh, okay, yes.
I think what the doctor is saying is very important, and that's where we missed, because we are told that we need to go home and my wife should be on family planning for 3 months, and then after that 3 months we'll be safe. Alternatively, 20 ejaculations. And for me, I just had the part of 20 ejaculations. So after 20 ejaculations, I'll now be fine. So we began counting, and it was like these 20 ejaculations were spread within the 3 months. And for us, after 1 week, we had done the 20 ejaculations, and then I told her, take off those pills. I think we are now okay. And that's how she got pregnant.
Oh, hang on a minute. Your wife got pregnant after your vasectomy.
Yes.
So, in this window period of 3 months, even after a vasectomy, it is possible to get pregnant.
Yes, it's possible to get pregnant. That's why we advise for backup methods. We'll counsel you on different types of family planning, so you'll choose on the one that is appropriate for you for that period, until we do a semi-analysis to rule out that the vasectomy was successful.
So we're talking about a backup plan, and I'm getting two types of backups here, where it is a question of 20 ejaculations, but within 3 months. So you can have 20 ejaculations in a week, right? But still the 3-month period has not lapsed.
Yes.
So how critical is for clients to understand those two? Because he says 21 week done, that's what he understood, but the 3-month period as well has to be met.
It's not really. These decisions are made after studies have been done.
Okay.
The studies show that even after 20 ejaculations, there is a high possibility that the sperms that were within the vas deferens or the sperm duct, they will have cleared all the 3 months.
Okay.
Yeah.
So this process of this procedure of an analysis that happens in what period after the vasectomy procedure is done?
After 2 to 3 months.
2 to 3 months. What happens during this analysis? What exactly are you looking for?
They look in terms of the count, and also most of the one that they look at, semi-analysis has a lot of things, but they look at specifically the count and also the motility. If there is if after looking at the semi-analysis they see sperm count, they'll give you a period, let's say for another 1 month, then you come back again so that they can reconfirm again. So we'll only say that vasectomy is successful after confirming that there's no sperm count in the semen. So maybe the case that is alluding to, I'm not sure if he came back for the semi-analysis before declaring.
Well, why don't we ask? Right here.
I'm not sure if he came back.
You can tell us.
Did you come back for semi-analysis?
No, I became my own doctor. I saw this is 20 ejaculations are done, and I think we are good to go. So we never did analysis after that, but I did analysis after delivery of the child. Now I was like, and can another one also come again? But now I found I was now clear after that.
So how many children do you now have?
4 now, 2 boys and 2 girls.
You plan and God laughs.
Yes.
Essentially, maybe that's what he wanted you to do. So you were bringing your 2, she was bringing her 2.
Yes.
Right. So now you have 4.
Yes.
Did you regret?
No.
Did you regret that you didn't go for the semi-analysis?
No. You see, the only fear we had is that my wife had just undergone CS in January, and it was in August she was pregnant again.
Oh my!
And all her pregnancies were through CS. So I was like, our fear was, is the sky even healed? Now I imagine the belly again beginning to swell and exerting more pressure on the same scar. That was the fear we had, not having another baby. So we were like, now what will happen? And then we had that fear that now if you go for CS, many times the woman may not come up back from the bed. And we were like, will she survive this again? So we went and met the doctor again who did. He's also a very good guy. He told us, no, it's okay, I'll do it. I know we've done even up to 12 CS on one woman, so this is not any life-threatening. And by now, if she had a CS in January, right now the sky is fine. So when we assured that, we were very happy with that. So yeah.
So when you sit with your fellow men and have this discussion, what are the myths that you hear every day? Because someone would look at you and ask you, shida yako ni nini?
Yeah, I have come to learn that there are different types of men in our society, and I've learned to live with all of them, interact with all of them. There are 4 types of men. The one is called traditional Tony.
Traditional?
Tony. Yeah. Traditional Tony is a man who believes in tradition, and he believes that God told us to come and fill the earth.
Yes, be fruitful and multiply.
Yes, and it's his whole responsibility to fill the earth, him alone. You know, this commandment was given to whole humanity. I bring it to you, bring it to, then all of us fills the earth. But he feels it is my responsibility to do it. This is a man who is against family planning, even for his wife. I've seen a man who tells his wife, can you go and remove those things because we have to fill the earth. There's a case I saw on TV, a woman has almost 22 children.
Amazing.
So this is a man who is against family planning, and he can't encourage you to do that. And then a second man will be there to support you.
Does he have a name?
Yeah, he's called
Supportive Sammy.
He's called Defensive Dan.
Okay.
Defensive Dan.
Yeah, this a man who will not allow you to. Anything you try to talk about family planning to him, he'll push it back to the wife. These are not things that I should be talking about as a man. These are women's issues, not men's issue. Ukimwambia that, can you go family planning? Anambia, yes, mwendo ongea na daktari akusaidie, because it's things for women. Okay. So he doesn't think it's for men. And then we have Supportive Steve. This Supportive Steve is a man who will support you. He'll go with you to the clinic. He'll be there to stand with you. Are you okay? Do you think this method is good? He'll ask, can we maybe have another one that can help her? He'll be there to stand with you in everything. But he's still saying, it's you. Can you change? Can you have this one better? He's standing with you. He feels your pain. Then we have Inclusive Ian, the last man. This is a man who will now ask, what do you think? Is there an option for men? When it comes to family planning, do we have an option for men? Can I do something to help my wife? So I have encouraged men who tell me that when you are not a man. In fact, you stopped being a man the day you went for vasectomy, and I embraced them. And then also I have so many men who have come and they told me, by the way, I also feel my wife is going through the same thing you are sharing. Can I also have it? But many of them are going through the same procedure. Many men are embracing it, because you see, I always wonder, when a woman undergoes TL, it's a normal thing. If you come at us by the TL, we won't even look at you. Oh, okay, you did. That's all.
For the purposes of those who are listening and don't know what TL is.
Oh, okay. Bilateral tubal ligation for the women. So you find that when women go through that, it's a normal thing.
Right.
You don't even question now. You went it. Oh, it's okay. You are still a woman. But for a man, which is just also vasectomy. Now TL for men is vasectomy. You are like, no. What happened? Why did you do that? So you should just embrace this just as any other family planning method without raising eyebrows.
So these are some of the questions that we're getting on socials this morning, and of those two, one of them which Salano mentioned, whereby there's the thought that a vasectomy reduces what will I now call it? That the thought of vasectomy reduces your manhood, that you are less of a man. You're less of a man in terms of reproductivity when it comes to vasectomy. From a physiological point of view, Dr. Is that true?
No, from a physiological point of view, that's a myth, because during vasectomy, as we already alluded, it's only that we block the passage. And we just block the passage, so hence it does not affect, because the manhood is given by the hormone called testosterone, which is usually produced by the testes, and testes we don't interfere with them completely. Yes, so there's no possibility of interfering with the manhood. And there's also a common myth that maybe if someone who has undergone vasectomy, the likelihood of ejaculating is not there, but that's also a myth, because usually the ejaculation has 5% sperms and also 95% in terms of semen. So still the person who has undergone vasectomy will be able to ejaculate. Yes. So there's no changes in terms of pleasure and also in terms of interfering with a man's ability. Yes.
There is also fear that it affects libido, does it?
No. It doesn't affect libido, because it's only that you have blocked the pathway, so it doesn't affect libido in any way. Because still the hormones, it doesn't affect the hormones or anything, so libido will be still there. Unless maybe there are also confounding factors. Maybe you have other issues apart from the vasectomy itself. Yes.
Are there any side effects after this procedure?
There are likelihood. There are some risk factors, but which are very rare. One of them is infection, but we usually give our clients antibiotics. There's mild pain, but we give them analgesics. So those are some of the possible side effects, but they are very minimal.
Okay.
As opposed even to the benefits that you'll accrue as a result of vasectomy.
Okay. So you talked about there being a plugging, right? So
Yes.
you're closing off I guess the same thing that would happen with the tubal ligation in women.
Sure.
And you said before that it is a myth that a vasectomy is reversible, but we still seem to have the idea in our heads that if you plug something, you can unplug it. So can that happen with vasectomy? Somebody can change their mind, Daktari, and decide, okay, I did this thing, but then down the line I've realized, okay, maybe I don't want this anymore. Can you go back and reverse things?
The answer is yes and no at the same time. The reason is vasectomy locally, there is we are not able to reverse it locally, but internationally there are conversations that are ongoing about the possibility of reversal, but it cannot be guaranteed.
What would be necessary to have a reversal done? Because I mean, the picture you paint was like you plug a hole, or not a hole, but you kind of like you clamp something, right? So can't you just unclamp? I may be simplifying a process here, but
usually the procedure is done. It's usually you cut and also tie at the same time.
Okay.
So it's like they are trying to reanastomose, so to bring together the tubes that are already tied.
Okay, I see.
Yes.
So I'm sorry to just liken internal procedures to plumbing, but I imagine that there is a pipe that the plumber was fixing in the kitchen the other day, right? And that there's a part of this pipe that you had to remove and tie so that water could flow in a different direction, right?
Sure.
So now if we're saying that actually I want this pipe to be brought back, so would you then be able to remove the parts that have been tied off and then rejoin them? Is that the kind of idea that you would be looking at for the flow of water to then come back?
Locally at the moment, that is, it's not possible, but globally there are those discussions.
So that's exactly what they would want to do.
They do that globally, but I'll go check more on it. Maybe in the next deliberation, I'll shed more light on what they do globally. But as much as they say that is reversible, they cannot guarantee of the likelihood of you regaining fertility.
Okay.
Yeah.
So Salano, yes. So you've gone through the process. You are in your healing process. One would assume that because people associate that procedure with extreme pain, and pain in that area for men, how it is.
You can't even talk about it. I mean,
you can't even talk about it because
it's uncomfortable asking the question. But okay, yeah.
There is that association of pain in the area. Just explain to us how it was, if you're able to go about your business the normal way during the healing process. How was it for you? Because one would say this thing is painful, that I need maybe to stay indoors for a week or 2 months before I heal. Is that the case?
No. On the D-Day, when the procedure is being done, there's a local anesthesia that is used. So doing the procedure, just make stories with the doctors. There is no pain you are feeling at that time because you've been given the drugs. It's a very comfortable procedure. After that, as he said, it's like maybe you had a razor cut on your finger. You just feel like, or a knife cut. There's some pain. So you are like, oh, something happened on my balls. Then you'll go and take the drugs. It's just the painkiller, the normal pain. Then it's not something that a big incision was made and then there was a stitching that was being done. It's like a very small incision that it's only one. It's just one stitch that is put to cover it up. So it's not something that they open up and then they do that, then they sew it back. No. And then I was told maybe 7 days I'll be fine. So I was in the house. I was just told don't use a motorbike or a tuk-tuk. Just be humble. So for that 1 week I was very humble in the house. After that I went back to my duties.
Okay. So we can't run away from the fact that even as you had a vasectomy, your wife did get pregnant in that period. And these are some of the questions that we're seeing coming on socials this morning. Dave asking and saying, well, here we have somebody who's actually telling us that he had a vasectomy, but his wife still got pregnant in that period. We talked about it a little bit, but let's understand why, from your perspective, that happened. And then we can look at it medically and say, this is what you must do to ensure that it doesn't. We'll start with you.
Yeah, so I think it was a simple thing that I was told to do. I was told once the procedure has been done, there are some sperms that have escaped into the pipes, not the tank. The tank is well secured, but into the pipes. So maybe you must ensure that the airway is cleared before you have unprotected sex. So for this period, you need like 3 months to have your wife on a family planning method that he was calling a backup, and then as you wait for the 3 months to elapse, and always maybe cover the 20 ejaculations. After that, go for a sperm count. After we have verified that now you are okay, we can now tell you, go ahead, now you are now fine. But for me, after the first week of healing and the second week of hitting the target, we said you are okay. So she was not on family planning for 3 months. She just did more, I think, a week or like 2 weeks, and then she withdrew from that, and then we assumed we were okay. So I think that's now where the pregnancy came in.
So do you use that as an example, Daktari, to talk to folks about what you need to do? Because what we will do as human beings is, if somebody had a vasectomy and the wife partner is pregnant, you know what we're going to say? That the vasectomy failed and that it doesn't work.
One of the myths is that after vasectomy, you are already on family planning immediately, because that is the assumption he made, and that is where maybe we are in. The wife had to conceive again, but usually there's a counseling pre-procedure and also post-procedure. Post-procedure counseling involves talking about the way I said earlier, talking about family planning and alternative, any of their choice, depending on which one they are comfortable. Then after the backup, you need also to come back so that you can they can confirm that the procedure was successful. Then after that, once they confirm that there's no sperm count, the probability of it being a permanent moted, it increases to around 99.5%.
Okay.
Yes.
So, Doc, there's a question that is coming here from one Kenneth Omondi. Can sperms be harvested after vasectomy the same way eggs are from women for the purpose of surrogacy?
That conversation, I'm not very sure if it's within the country, but while I was reading it somewhere, I saw it was possible. Sometimes you can harvest the sperms even before the procedure, so that you can put them somewhere under a cold chain. Then in case there's a change of plan in future, you can use them. But I don't think Africa or Kenya as a country have reached at that level. But maybe I do more research if it's possible in Kenya, but I don't think so. But globally, it's possible.
I think I checked on that, and there's a hospital here in Nairobi that does that.
After vasectomy?
Yes, after vasectomy, and you feel you need your sperms extracted. There's a name they call it. Yeah, I saw this the hospital here in Nairobi that does that.
Okay.
Yeah. So they can extract, then they can at least then
and they can be stored for future use if you decide you want to have a child.
Or if I want a child today, I can go there, extract, then they
Okay.
Okay.
The issue of blood type is coming up, and folks are saying that because of the fact that we all have different blood types, that in vasectomy this matters as well. Is this a myth that based on your blood type, if you did have a vasectomy, things could actually go wrong? And or for some people it would be fine, but for other people it would be a disaster. Is that true?
That's a myth. Huh?
Okay.
There's no relationship between the blood type and also with the vasectomy. Yes.
Yeah. So, Salano,
Yes.
I just want us to talk in terms of. So here we are having a discussion about family planning, right? Use of contraceptives, and this has been left predominantly, especially in African context, pretty much across the world. It is a woman's thing.
Yeah.
You know what I mean? But here we are having a discussion about the need of men equally to play their role in this conversation, you know. So we have, like you say, your wife had different side effects with regard to contraceptives she was using. How critical is it for men to equally jump on this bandwagon and be solution providers, other than dismissing it as being a woman-only affair?
I said, I'll repeat again. I say that the word family means me and my wife. When my wife is out of the picture, I'm no longer family. I can't be family alone. And when I'm out of the picture, she can't be family alone. So family is about me and her, and then maybe with kids. So when we talk about family planning, it's the two of us planning for a family. It's not about women. So it's no longer family planning. It has now become women's family or women's planning.
Yeah.
It's no longer family planning. It's women's planning. Because we find that in most cases, even a man will ask you, why do you get pregnant? Are you normal? Why are you getting pregnant this time? Can you see the economy? So it's like, now, why do you get pregnant? Yet he's the one who, it's like she went and picked the pregnancy from the road, not him. So
swallowed it.
yeah, we always stay away, yet we are the cause of all this. So it's something that you have to sit down with your husband and wife, and then you discuss about it. So we say that even the doctor told you that family planning methods have no side effects. But if I tell you that now this thing has no side effects, maybe I'll tell you a mango. If you eat a mango, you don't feel anything. But if you take something like alcohol, then you feel your head is going round. That's a side effect. If I can take a drug and then I see I'm having headaches throughout, there's a side effect. When you see I take something, then I'm just adding weight, or I'm reducing, or I'm just becoming, my face is coming, a lot of pimples coming on my acne. That's a side effect. If I used to go for periods for 4 days, once in a month, now I'm going 7 days, 3 times in a month, that's a side effect. And this is one of the things that's even making marriages break. Marriages are breaking because of family planning methods. I have a lot of cases coming to me, like a woman told me that for me and my husband, there's no method that is working for me. I've tried all, but I have a lot of side effects. Now, for now 2 years, we never spend on the same bed with my husband. Because if I go and sleep with him, I'm going to get pregnant. Now we have 6 children. Now it's like that marriage is dying. Yet if they have 6 kids and they're satisfied, it's as simple that this man can just take a procedure and be in his happy marriage and save this wife from that. Because most women are really sacrificing for their family. When you see a woman going for a planning method, it's not that she's happy about it, she's sacrificing for this family. So is it also very hard for us men also to try and sacrifice, also save the family?
Yes.
So I think it's something that we also just come and say, no, this is a burden that we can carry, both of us. If you've tried and it's not working for you, can I also try? Okay. Yeah.
Doctor, is there an age limit to which vasectomy then can be performed on men?
No, there's no age limit on which vasectomy can be performed in men. The only thing that you will consider is being a permanent method, you are supposed to make sure that someone has already made a decision that there's no future desire for children. Yes.
But as a medical profession, it's fine, there is no age. If an 18-year-old shows up, how do you approach that? Or a 16-year-old?
And they've made the decision out of high school, say, I don't want to ever have children.
Usually before the client accepts any procedure, there's a provision where you are supposed to, the client is supposed to sign consent. But within Kenya, there are decisions where someone can make a decision, but he needs a guardian or someone to witness that decision. The procedure has been explained to the client, and the client has understood, and in the language that he can understand well. The indication and also the contraindication. And witness sometimes can be the parent or even a guardian. Yes.
So in your profession,
because there's the aspect of autonomy, the matters there. Like someone has the ability to make decisions on. Yeah, but they need a witness because of the cut-off limit in terms of the Kenyan law.
You wanted to add something?
Yeah, I think, and I've been having an issue with that, I think there should be age limit for this thing. Because I've seen when people coming to my timeline, they're saying that I regret doing vasectomy. I did at 22 years old, 23 years old. So I'm like, at 22, what do you think about family? Maybe he just felt like girls are taking family planning methods while in high school to prevent pregnancy. Then he said, let me also do it to prevent giving girls pregnant. Now he reaches around 25, 26, 30 and says like, now I think I need a family. And so I always tell guys, I think be at least 35 years and above. You have had your family and you are making a mature decision. I know that I not regret the thing ahead again, because I know I already have my children right now, and I have discussed with my wife, and I think we don't need any other child.
Plus, we're also looking at the age of. I mean, just to add to that, I imagine that what psychologists tell us, what that learning experts tell us, and formative experts tell us is that it is at that age of 25 where you're now fully psychologically mature. That at least you've reached your maturity at that level, at that age of 25. You can't be making lifelong decisions at 18 or even 19. That it's at 25 years old when you can say, okay, fine, this person. We're also looking at physiological forming of the brain, which finally happens at that age. And so that's now when you can actually make those lifelong decisions. And then I also think do that with some information.
Apart from just having maturing at 25, when it comes to vasectomy, you need more than just 25. Because if you have to go for vasectomy, also look at your history with your wife. Do you think you've been having cases of mistrust in our marriage? Our marriage could end any time from now. You can't, if you are 25, when did you marry? I think we are not 35. If you've been married for around 5 years, 10 years, you can now make a sound decision when it's come to family issue, not just other issue, but there are family issues. Now, me, I did when I was thinking I was in my 13th year of marriage. And from that period, we had developed a very strong trust with my wife, and I knew where we were going and where we had come from. So it didn't take me a lot of thinking about it. But I've been seeing comments like, if your wife leaves you, what will happen? If your kids die, what will happen? So such things. But
Dr. perhaps is that maybe a conversation we could start having in the medical circles in terms of an age limit? An age limit where we need to start having discussions on this.
That issue is I choose to hold my thoughts on that. I choose to hold my thoughts on that. Let me not comment for now about the age limit. Yes, thank you.
Okay.
So you talk about it being a simple procedure, and we see other procedures. I mean, even childbirth is done even at home. The issue of going into a medical facility to have this done is an issue for a lot of people. Is it something that can be taken out of a medical facility, done at home? 15 minutes to 20 minutes that you speak of?
Well, when we say it takes less minutes, or it's a minimal invasive procedure, it takes around 15 to 30 minutes. It means that there are some, initially in medicine, the categorization of procedures is a procedure that don't need to be admitted for it to be done. It's done, then you will go immediately once you're comfortable, even within 15 minutes after the procedure is done. That's what we mean by it takes less minutes, and also it's a minimal invasive procedure. Yes, but usually it's good to do it within a setting, within a facility, within a
controlled environment.
Controlled environment, yes.
Are we seeing more men take up these kind of family planning vasectomy?
Yeah, there's an increase in terms of the number of men who are taking the contraceptive, and the beauty about it, they're usually being accompanied by the partners. and even sometimes on case-to-case basis at marriage stops, we can allow the partner to join in because matters sexual reproductive, it's not about an individual, it's about a collective responsibility. So if all of them, they consent that the wife has to be there, sometimes we do allow on case-by-case basis. Yes.
You mentioned that there's psychological counseling that takes place before a vasectomy is done. What happens in that psychological counseling procedure?
It's not really a psychological process, but usually you make sure you explain to the patient the type of procedure he is about to undertake. You tell the patient that it's a permanent procedure, and also you tell the benefits, and there's likelihood of not having children after the procedure. So those are some of and then you explain the procedure itself, what you're supposed to expect in the procedure room, and what you're supposed to expect in terms of post-operative, post-procedure. That's what I meant by saying there's counseling that takes place.
Okay.
Yes.
And what are the cost implications of a vasectomy? How much is it going to cost somebody to have this procedure?
The cost implication within marriage stops is cost-friendly. It's something that cannot break someone's pocket, but outside there are a lot of, it can cost a little bit more, up to around 50,000. Sorry, 150,000. But marriage stops is cost friendly. Sometimes it can be even. Let me not give the figure, but it's cost friendly. It's something that cannot. It cannot break someone's pocket at marriage stops. Yes.
So how much did you pay for it, Salano?
No, for me, it was an outreach, so I didn't pay.
Okay.
Yeah.
And roughly how much does it cost?
Okay, for me, they told me around 20 to 25K.
20 to 25K. Okay.
Right, around there. Yeah. There is still. This is it's a physical procedure. It's a medical procedure that takes place for all intents and purposes. The science comes into play. But it is very heavy when we then talk about the softer issues like feeding like a man being. We don't hear this kind of conversation when a hysterectomy is being done by a woman, for example, or when she's having her tubes tied, or that kind of permanency that comes with things like that. We don't hear as much as we do on the side of men for vasectomy. And getting people to wrap their heads around this option seems to be so difficult. What do you think it's going to take, even as we look at the physiological and the medical, for people to be a little bit more accepting of that as a process? Because we are essentially saying the same thing that happens with a woman in tubal ligation is the same thing that is happening for a man with a vasectomy. What's it going to take for people to realize that this is an option?
I think we need to do mass education, but also those people who can read. Or who can go online and search, do it. Because for me, before I made this decision, I did my own research first. Before I met the doctor, I did my own research first. I looked at it. Does it have side effects? Is it reversible? Does it affect your erection? Does it affect your ejaculation? All those facts, I had them. I went on YouTube and looked for the testimonies of guys who had done it. I saw the testimonies, I've done this and I'm fine, my family this, and all that. So you don't wait for me to tell you what to do, but just go and do your own research first, do your conclusion, and be able to make up your mind. For those who are in the village, you can go and educate them, tell them this thing is not bad as you think. But for someone who has gone to school, because I find those who are arguing, the people who are going to school, they are even in medical field, they'll tell you, you have been castrated, but that's a soft name for castration. And they can just go and read, even just find the difference between castration and vasectomy. You'll see the difference.
You'll see the difference.
Yeah.
All right. Even as we come to the close of this, Dr. how do folks get in touch with you if they want to start asking questions, get in touch for the procedure?
If they want to get in touch with us, they will contact us via a toll-free number which is 08 00 72 0005. I repeat it again, 08 00 72 0005.
So that's 0800 72 0005. Get in touch with the folks at Mary Stopes, be able to help you at least answer those questions at the very least. Thank you both of you for being here this morning, looking at some of these sensitive issues, but necessary to have these conversations, and that's what we do in the Situation Room.
You can also reach me through my social media platforms as Vasectomy Man. TikTok, Facebook, Instagram.
Vasectomy Man.
Yes.
Thank you so much for being here.
This is the Situation Room, the only way to start your day.